Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, the one that can't ever answer a joke correctly. So I need your calls right now before he tells another one that I can't answer correctly.
I'm going to get you, Nita.
So that number is 866-870-5752. Right here in the studio, you can speak directly with Dr. Darrow about your musculoskeletal pain. That's our topic here on Living Pain-Free. That's the point, the title of the show, so you can live pain-free and do your sports or whatever you want to do. Check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. And if you're ready to call the office because you've been listening for a while and you know you want an appointment, you can call right now, anytime, 800-300-9300. That's 800-300-9300. And please call the show. You get a free book. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And our call-in number right here, right now, 866-870-5752, right here in the studio. And where else do you get to talk to a doctor for free, I ask you, right?
So, Nita, you forgot about Suzanne Summers writing the foreword to this book. And she's a great friend of mine. She saves a lot of people from medication and surgery they don't need, which is exactly what I like to do. She also wrote a chapter about me in her new book. It's called A New Way to Age, and it's on page 302. I think it's about 16 or 19 pages about my work. So her job, her mission that she's taken upon herself, or maybe Spirit gave it to her, is to educate the world about how people can heal without medication and surgery. So thank you, Suzanne Summers, and how to do it naturally, which is the kind of work I do, by injections of a person's own cells from their body. We use bone marrow, which we take from the pelvis. I numb it up, and then once it's numb, it takes about 10 to 15 seconds to do the procedure if we get lucky. And also, we can use platelets from the blood, but the bone marrow has platelets and stem cells. The blood is just mainly the platelets that we use. So, Nita, time for punishment. Why did the robber jump? Why did the robber jump in the shower? He wanted to make a clean getaway.
Okay, you should have hesitated because I was going to say something very close to that. I was going to say
you gotta work faster. The mouth has to
clean him and clean off the money he stole, to just clean up everything.
That's good, but that's not a joke.
Yeah.
Okay, one more chance. That's it.
All right.
You ready?
Ready.
Why do you call a snobby criminal, or what do you call a snobby criminal going down the stairs?
I have no idea.
A condescending.
Oh, that's a good one.
Isn't that cute?
Very
adorable. It's funny. I think these are just dummy jokes because we can't tell real jokes anymore. We don't want to hurt anybody's feelings. But when patients come in and they've heard these jokes on the radio, they go, God, those were so amazing. That was so funny.
They do.
Anyway,
well, they love that I don't know the answers. That's why they're laughing.
I think that's what it is.
Yeah, it's okay. I can take it. I can take it.
They're laughing with you. All right. So I have. We send out if you go to my website, which is www.lastemcells.com, you can find a spot to join my newsletter, which we send out every day on different subject matters, and. This next question is coming from someone who got a copy of the newsletter and had a question about it, about their father. So they send me back a copy of my newsletter, and they said, my father had had back pain for his whole life since he was in his teens, and finally consented to a laminectomy. A laminectomy is when part of the vertebrae is removed where the nerve comes out so it doesn't impinge on the nerve, okay? Sometimes it's a great idea and sometimes it's a terrible idea. It just depends. Many people who get it done when there's no nerve impingement. Now, if your leg is dead or it's so painful you can't stand it or numb, then you might consider doing that procedure. But I see way too many people get it done because the surgeon is treating the MRI, the magnetic resonance image. And that's really not a great idea, because when you treat the MRI, that doesn't mean you're treating what the problem is in the patient. So many times people come in and had a laminectomy or a fusion in their back, and I go, "Did the doctor ever touch you?" No, they didn't touch me. They showed me the MRI and showed me what the problem was. You can have pain somewhere, but it's not shown in the MRI, so we have to be very careful. I'll say it like this: MRIs are big liars. They're helpful, and I like to see them, but they don't tell me what's going on. They might, but they might not. Most cases with back pain, they don't. So I've had several patients who came in with central back pain, right above the buttocks, on the pelvis, in the low middle of their back or in their neck, and they get a back surgery or a neck surgery for that, and it makes them worse because it wasn't the problem. Most of those issues right in the neck and the back are really, I know you're going to think I'm crazy, maybe I am, they're ligament sprains. There's ligaments that hold the vertebrae together, and if your surgeon does not touch you to find out if that's the problem, he is doing you a disservice. It's not a good idea to operate on someone until you examine them, and examination means touching. A lot of people are so high-tech now, they don't touch. The doctors don't touch. They rely on the images, the x-rays, and that's not a good way. I've seen so many people get hip replacements, as an example. When it wasn't the hip joint, it was the greater trochanter. And this particular person, their poor father had a surgery, and then they ended up with post-laminectomy syndrome. If you get my, it's actually, if you go to my website, there's a whole article about it, and this has to do with problems that, actually, I'm looking at the statistics here. The surgical procedure is really required in only 1 to 3% of the cases. 20 to 40% of patients undergoing lumbar surgery will not experience benefits, and the condition will worsen in many of the patients. So we have to be careful. Surgery is a commitment. It's not like getting married where you think it's a commitment and you get divorced. Once that knife goes in.
Good point.
I love hearing you laugh, Nita. It makes my day. So my point is, don't jump into it. Find someone who does regenerative medicine. Find an expert. Find someone who does it all day long and who's done it for 20 years or more. Don't go to some Johnny-come-lately or a chiropractor who is bringing in a nurse or a doctor for the day to do it. Go to somebody who does it all day long, every day. Ask them, how many have you done of what I have? And then when they tell you, say, how many did you do yesterday? How many did you do the day before? Make sure you got a guy who does a lot of it. This is very, very, very complex work. There's a lot of intellectual wisdom that has to go into picking the right patient and finding out where the pain is coming from. Where is the pain generator? That's the big, big, big question. Don't go jump into a knife that you can't take out. Once that knife is in there, there's a lot of damage that is done.
And if you have that kind of concern going on, call us right here, right now in the studio, 866-870-5752. You get your free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. The foreword is written by the lovely Suzanne Summers, and it's waiting for you right here, right now, 866-870-5752.
So, Anita, you need a little punishment of a joke. No one's calling. All right. What's the difference? Put your brain on.
Okay.
What's the difference between a poorly dressed man on a tricycle and a well-dressed man on a bicycle? A tire.
Oh, that's a good one.
Isn't that good? I love that one.
That is a good one, yes, because I'm a clothingaholic, as you know.
You are not.
I am. I need to get a bigger home so I can have 2 walk-in closets.
That's so funny. You know, when my son Benji was real little, we went to a friend's house on the Wilshire corridor, and he was in the entertainment business. And we walk in, and most of his place was walk-in closets, giant walk-in closets that he had built. And little Benji walks in, and his head is moving around like what is this? He can't figure it out. Is this a clothing store? We're gonna go to a big toe.
We
okay?
are. Hi, Rick.
Hey, Rick, you got a big problem with a little toe. This is Dr. Marc Darrow. How are you today?
Dr. Darrow, how you doing? It's a pleasure and honor. It's not the little toe, it's the big toe.
Yes, that's the most common problem.
Wow, well, I don't feel alone then. This goes back to, decades ago. Yeah, over 20, maybe a decade and then two and a half decades ago. It was an old injury playing football. I got involved in a little pickup football game there. It was way back when I was living back in the East. I'm not living out here in the West now. So, I felt it at the moment when it happened. I guess someone just stepped on my toe. And it was okay. Yep. I've walked all these years, but now it's like kind of, it's just not 100%. I can kind of feel it. And I was wondering, I soak it from time to time and just like hot water, but I can walk. I've walked all these years, but now I'm not troubled or anything, but I'm just thinking, okay, can I make it perfect again?
You can probably make it perfect again. I can't promise you. I haven't touched it, but I work on those almost every day, not every day. One suggestion for you before you get to me: soak it in scalding hot water, like the hottest water you can take, but put some what's that salt called? Epsom salt.
Oh yeah,
you can get Epsom.
Yeah,
you can get Epsom salt at a drugstore or at Ralph's or Vaughn's or anywhere you want. And buy a big bag of it. It's cheap, and put in half a cup or so, and that has magnesium in it. Helps loosen up the tissue, loosen up the collagen, and it might help free that up. Now, years back, there was a football player with the Detroit Lions. You're into football, so you probably know this guy. His name was David Sloan, Sloan, and David had surgeries on his, multiple surgeries on his big toe. With what's called turf toe, same thing as you. The football players get their feet stepped on all the time. And we did regenerative medicine on his toe, and he healed up completely. He was able to finish up his season. And God bless you, David Sloan. You're a beautiful man. And he used to fly up. I think he was in Tucson at the time, living there. And he would fly up once in a while and get his toe injected. And we had great success with that.
Okay.
Sometimes it turns into a bunion. Has yours started growing where you see it actually increasing in size?
Yeah. I got to apologize, Dr. Joe. I don't have the best phone reception where I am right now, but I can hear you.
Okay, no problem.
So,
no problem.
That's great, man.
So I have another guy that has that, where he has the bone that's grown up, so it's arthritic. And he lives all the way in Texas, and he flies up to see me every couple of weeks or so. And he's almost, this is the shock of this. The bones were sticking up from the joint. They had hypertrophied. Yeah, hyperostosis, you call it. And that is flat now. After a couple of treatments, it just flattened out. The white blood cells in the regenerative medicine, we use stem cells on him. The white blood cells chew up the bad tissue, and regrow the good tissue. So he's a happy camper. And
wow.
I think you can be too, but again, I can't promise.
I'm sorry.
No, your turn. Go for it.
Oh, okay. When you said at the beginning, I can bring it all the way back. See, I work out kind of sometimes walking around and going up, and I might see a staircase every time I go up and down the staircase a couple of times. And I try to stay in good physical condition, almost like back in my playing days. And the thing is, when you said what you just said there, it can be almost brought back perfect. You just say, keep soaking it. Your regenerative stuff? Yeah, I mean, I'll read your book. I'm going to get your book. Well, it'll bring it all the way back, right? Because I mean, I've walked all these years.
Oh no! Don't put those words in. Don't put those words in my mouth. I told you about one particular guy. Okay.
Oh, okay.
I've done probably thousands of those. Usually, what will happen is the swelling will go away. Some people, it's really irritable and swollen. The soft tissue becomes edematous. That often will go away, and sometimes the bony growth will start to go away. But I'm not promising you're going to have a new toe. No way. If you get some relief, you'll be happy. Yeah. I haven't even seen it. I can't diagnose over the radio. You and I might be talking about different things. Yeah.
Okay. Sure. Well, okay. I may come out to see you. You know, you're very good with this regenerative stuff, the way you sound on the radio. So I appreciate you. I really appreciate you. I'm going to try
God bless you, Rick. Yeah, try the Epsom salt. If it's not working for you, another thing that can help is we can make orthotics to take the pressure off of that toe. There's a lot of things that can be done, but I have to look at your foot, and before you come in, wash your feet and wear clean socks.
Of course.
You would be shocked at what walks in my door. Or the best is someone has knee pain and they walk in with latex pants or leather pants, and I go, "Can I see your knee?" Well, they go, "Well, I'm not sure I can get these pants off for you to see it." We have a good time, I'll tell you. We have a great time. We're laughing all day long.
There you go.
Most people that come in to see me they go, "God, this is not even like a medical office." No, I don't want that vibe. I want people to be happy. I want them to be laughing. We tell jokes all day long.
That's good. You tell some pretty good ones too. Yeah, that's you should get a little Rodney Dangerfield type in you. Okay, good.
I love that guy.
Yeah, I love him too. Yeah, he's still around. You know, he may have passed on. Yeah.
Rick, God bless you. Thank you so much for your call.
Thank you.
We appreciate that.
All right, thank you. Have a good day.
Thanks.
You too. So our number to the studio, you can talk to me. We got a few minutes left. Don't wait till the last second like people always do. Phone number, write it down, 866-870-5752. Once more, it's 866-870-5752. And the website, you can watch me do videos there, is www.lastemcells.com, www.lastemcells.com. And if you're too shy to call in, I don't know why you would, just use a fake name. But if you are shy, you can call my office, 800-300-9300. I'll repeat it, 800-300-9300.
And you can also go to the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. It's very educational. And if this is new to you, regenerative medicine, then you want to find out more. And when you phone the program today, you also get Dr. Darrow's latest book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Forward is written by Suzanne Summers, and it has 264 scientific studies. And that's that.
Some people need the studies, so I gave it to them. You know, most people that come in who have been to an orthopedic surgeon first and say they're coming to me to the surgeon go, "Don't waste your time. That can't work. You can't grow tissue." Really? If your surgeon thinks that, I'll send him a free copy of the book too. I'll send you to him. You can bring it to him. He can read his own research it's pretty weird because the orthopedic surgeons do this research, but most guys don't read their own research. I don't get it.
I don't get it either.
I mean, there's so many natural ways to heal the body, but the traditional, typical MD doesn't read his own research. The stuff, everything that we do has been researched. I was doing it before there was any research because I did it because it worked. It worked on me and it worked on my patients. It doesn't work on everybody. It doesn't work the first time necessarily. It may take a few treatments. But it does work if you stick by it and the proper syndrome or diagnosis is being healed. You can't use it on just anything. Unfortunately, there's a lot of, I'm not putting down chiropractors because I love them. I do go to chiropractors. And I'll give out the name of my favorite one in Santa Monica. His name is Randy Weinzoff. He's amazing. Weinzoff. Randy, I know you're listening. God bless you, man. I do love chiropractors. I don't like when they have dinners for elderly people who come there just to get a meal and then get hustled to have stem cells done for things like multiple sclerosis, bad vision, neuropathies, all these things that stem cells don't really do anything for. They're being studied, but these guys are actually being prosecuted now all over the country. Thank goodness, because they're giving my practice of medicine a bad name. So watch out, guys. They're coming after you. If you're going to a chiropractor for other reasons, I think they're amazing. I love chiropractors. I've been to chiropractors for the last 50 years, and they can do things that medical doctors cannot do. It's so funny because the medical doctors don't believe in the chiropractors, and the chiropractors don't believe in the medical doctors. So I think it's good to get an ecumenical point of view and go see everybody and see what works for you. In everything. Have an open mind when it comes to medicine or anything else.
Having an open mind, that's the key.
It really is, for anything. You know, I get patients in the office politically on one side or the other, and they're yelling about it. And then the next patient comes in as the opposite, and I go, why do people have to be so opinionated, and how do they know what's going on? It's the same in medicine. You got to check it out. When you go to a doctor, ask, how often do you do this procedure? Make sure you got a guy that does it all the time. You want a guy who's been doing it for a long time.
Or a gal.
Same with, or a gal. You know, we used to be able to say guy and include women, but I guess you're right, Nita. Now it's got to be very specific.
And we also want to be inclusive of everybody, but change is upon us, and if this is a new paradigm for you, please go check the website out at www.lastemcells.com. That's lastemcells.com. And call and get the book, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. 866-870-5752, right here in the studio.
May I take one quick question? We got a couple seconds left. Of course. Okay, this one says pain area, chronic knee pain. Chronic means more than typically 3 months. Acute is within that shorter period. How long in pain? 6 years. Recommended surgery? Yes. I've actually had 2 surgeries on my left knee and gotten worse. Oh, there's the banjo. Time to go.
Time to go. Okay.
Give me a call at the office, 800-300-9300. Go to my website, www.lastemcells.com. Watch me do these procedures. They're easy.
Thank you, Dr. Darrow. Thank you. Thank you. Thank you, everybody, for listening. And listen to Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens. See you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.